A pharmacist scans a prescription. Nothing. Scans it again. The screen just says, "The system is down." Behind that counter is someone's cancer medication, and right now, no one can release it. It's February 2024, and at this exact moment, the same frozen screen is stopping prescriptions in thousands of pharmacies across America. Not a shortage, not a natural disaster, a single ransomware attack on a company most Americans had never heard of. Some patients pay hundreds out of pocket. Some just go home without their medication. Change Healthcare. You have probably never seen the name, but it sits in the middle of American healthcare like a switchboard. Roughly 1 in every 3 U.S. patient records passes through its systems, around 15 billion transactions a year. So when it went dark, a third of the country's healthcare payments went dark with it. And Change Healthcare would go on to pay a $22 million ransom to make it stop. It didn't stop. Here is how it started. On February 12th, attackers logged into a Change Healthcare remote access portal using a stolen username and password. That portal had no multi-factor authentication, no second step, no code, no app, no prompt, just the password. If you have watched this channel before, you know where this is going. The Colonial Pipeline attack that ran the East Coast out of gas started the exact same way. One password, no second step. The most damaging healthcare hack in American history began with a login that a free authenticator app would have stopped. For 9 days, they moved quietly through the network, mapping it, copying data, up to 6 terabytes of it. Names, diagnoses, test results, social security numbers, insurance records. Then, on February 21st, they pulled the trigger. Files across Change Healthcare's systems locked, one after another. The group behind it called itself ALPHV, also known as BlackCat, one of the most prolific ransomware crews on Earth. To stop the spread, UnitedHealth Group, Change Healthcare's parent company, pulled its systems offline. And that is when the whole country felt it. Pharmacies couldn't verify insurance or process claims. Hospitals couldn't bill. Doctors' offices stopped getting paid. Some small practices went weeks without revenue and started missing payroll. UnitedHealth ended up advancing more than $3 billion just to keep providers afloat while the system was down. But behind the scenes, a different decision was being made. The attackers were still holding 6 terabytes of stolen patient data, and they wanted to be paid. Change Healthcare paid $22 million in Bitcoin sent to ALPHV for a single promise: delete the data and never leak it. For a moment, it looked like the worst was over. Then the criminals turned on each other. And this is where the story goes somewhere almost no one saw coming. Here is what happened inside the gang. ALPHV did not carry out the break-in alone. Like most modern ransomware operations, it rented its software to an affiliate who did the actual work. When the $22 million arrived, ALPHV kept all of it. They cut their own affiliate out completely, posted a fake law enforcement seizure notice on their leak site, and disappeared. An exit scam. But the affiliate still had the data, so he carried it to a brand new ransomware group called Ransom Hub and extorted Change Healthcare a second time. The data was leaked regardless. Change Healthcare paid $22 million to protect information. That ended up on the dark web anyway. The ransom bought them nothing. The full scale took almost a year to admit. Change Healthcare first said around 100 million people were affected. The final number was roughly 190 million, more than half the country. And this is the part that should stop you. If you are an American adult, there is a very real chance that your name, your diagnoses, or your social security number were sitting in that stolen data. It is the largest healthcare data breach in United States history, nearly double the previous record. And when UnitedHealth's CEO, Andrew Whitty, was asked under oath how the attackers got in, the answer came down to the same 3 letters this whole story keeps returning to. The portal had no MFA. So what does this actually teach? 1. Multi-factor authentication is not optional. The most damaging attacks of the last 5 years keep starting at a login with no second step. 2. Concentration is its own risk. When one company sits under a third of a nation's healthcare, one breach becomes everyone's breach. 3. Paying a ransom guarantees nothing. Change healthcare paid, and the data leaked anyway. You are trusting criminals to keep their word. The people who felt this weren't executives or hackers. They were patients at a counter who just wanted their prescription. And for weeks, a single stolen password stood between them and their medication. If this is the first time you're hearing how close the whole system came to failing, subscribe. This channel breaks down the attacks that actually shape the world you live in. And tell me in the comments, should paying ransoms like this be illegal? Next week, we go from a faceless gang to a group of teenagers who walked into Uber, Microsoft, Nvidia, and Rockstar Games and leaked Grand Theft Auto 6 before it was even announced. They didn't use anything sophisticated. They used a text message and a lot of nerve. Lapsus $, next Tuesday.